Now, look at Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about different complications following heart attack.
Hello, doctor. What types of complications are expected following heart attack?
Well, there are 2 types of complications that can occur following a heart attack. The first problem occurs pretty much straight away, and the second complication occurs later on. Immediate complications following a heart attack are arrhythmias is the immediate complications in which the heart beats irregularly, either too fast or too slowly. Cardiogenic shock is when the patient's blood pressure drops suddenly. Therefore, the heart cannot supply adequate blood for the body to function properly. Hypoxemia is the condition when the oxygen levels in the blood become too low. Pulmonary edema occurs when the fluid accumulates in and around the lungs. Deep vein thrombosis occurs when the deep veins of the legs and pelvis develop blood clots that either block or interrupt the flow of blood in the vein. Myocardial rupture occurs when the heart attack damages the wall of the heart. That has an increased risk of a heart wall rupture. Ventricular aneurysm is when a heart chamber called a ventricle forms a bulge. Question 26. You hear the discussion between 2 doctors about the impacts of acute kidney injury.
What are the impacts of acute kidney injury, doctor?
Acute kidney injury is a common and severe complication of surgery, especially cardiac surgery. Often, the complication is associated with higher rates of morbidity, mortality, and cardiovascular events, longer hospital length of stay, and higher cost. During stage 1, there will be an increase in serum creatinine of 1.5 to 1.9 times baseline, an absolute increase of at least 0.3 milligrams per deciliter, or urine output of less than 0.5 milliliters per kilogram per hour for 6 to 12 hours. During stage 2 of acute kidney injury, there will be an increase in serum creatinine of 2.0 to 2.9 times baseline, or urine output less than 0.5 milliliters per kilogram per hour for 12 or more hours. During stage 3 of the condition, there will be an increase in serum creatinine of 3 times baseline, an absolute increase of at least 4 milligrams per deciliter, initiation of renal replacement therapy, urine output less than 0.3 milliliters per kilogram per hour for 24 hours or more, or anuria for 12 or more hours. Question 27. You hear a discussion between 2 doctors about acquired melanocytic nevi.
Hello, doctor. What are acquired melanocytic nevi?
Acquired melanocytic nevi are clumps of melanocytes that originate during childhood but manifest during 30 to 40 years of age. Junctional nevi form macules, with the skin markings becoming slightly more prominent. They are circular flat lesions with a uniform brown coloration. They have lentiginous cells, which are round or oval or spindle-shaped. Dermal nevi are raised pale brown or skin-colored lesions, and often hairy, having focal globules and fine vessels or pale areas. Pseudo-horn cysts may be seen. The cells are epithelioid with amphiphilic cytoplasm, and the melanin is in granules. Compound nevi may be raised with a wart-like surface in certain cases and are usually lighter brown than junctional nevi are. They have round or oval globules of pigment, and these may form cobblestone patterns. Question 28. You hear a discussion between a doctor and nurse about amblyopia.
Hello, doctor. Can you explain what is an amblyopia?
Well, amblyopia is the medical term for lazy eye that refers to a condition in children where the vision in one eye fails to develop adequately. This usually affects ability of the child to see using the weaker eye. In strabismic amblyopia, a squint develops due to a mismatch between the muscles that support the position of the eyes. Therefore, the brain ignores the eye that is not straight and relies on the images generated by the stronger eye. In a condition called anisometropic amblyopia, the refractive error is greater in one eye than the other eye. Therefore, the brain ignores the more farsighted eye and relies instead on the eye that provides a clearer picture. However, the weaker eye remains straight. Therefore, the defect may go unnoticed by the parents or primary care doctor. In the condition called deprivation or occlusion amblyopia, one eye is deprived of vision due to the development of a blockage, such as a cataract. The ocular media becomes opaque, preventing visual information from reaching the brain. Question 29. You hear a discussion about miliaria.
Hello, doctor. What is miliaria?
Well, miliaria is the conditions associated with sweat retention in the skin. When the flow of sweat is obstructed, the sweat stays trapped within the skin instead of moving out from the sweat glands to the surface of the skin, developing various symptoms and signs including skin lesions. Miliaria crystallina, also called pseudomina, describes sweat duct obstruction in the uppermost epidermis, where the sweat is retained to form subcorneal vesicles. These clear, non-inflamed, fluid-filled blisters and papules rupture easily, and even light rubbing can cause them to break. Miliaria rubra, also called prickly heat, and refers to the retention of sweat that moves into the middle layers of the epidermis and the upper dermis, resulting in itching and redness around the sweat pores. Miliaria pustulosa occurs when the miliaria rubra develops as inflamed pustules. Miliaria profunda occurs when the sweat moves from the ducts into the dermis. Hard, flesh-colored, painful papules develop that are much larger and more deeply located than the papules seen in miliaria rubra. Question 30. You hear a lecture about different type of stents. We see today what is stent and what are the different types of stents. Stent is a splint that is placed inside a duct, blood vessel, or canal temporarily to aid healing or relieve an obstruction. Primarily, they are used to keep narrowed blood vessels open and patent, to allow sufficient blood flow or bodily fluid. Coronary stents are a tubular, mesh-like device that do not have any embedded medications in them. Drug-eluting stents are coated with medications to prevent inflammation and retinosis of the artery on a long-term basis. A urinary stent is used to hold open the ureter in cases where it is narrowed. Ureters are long tubes that carry urine from the kidneys to the bladder, where it is stored until it is emptied. Urethral and prostatic stent is used to open up the narrowing caused by an enlarged prostate pushing against the urethra, preventing the normal outflow of urine. Peripheral vascular stents are used to keep blood vessels outside the coronary arteries open. Stent grafts are tubular devices made up of a special fabric that is supported by a rigid metal stent. These are mainly used for vascular surgeries, such as to repair abdominal aortic aneurysm. Stents can also be used to keep the food pipe of the esophagus open in case of esophageal constriction, and biliary stents can be used to maintain adequate drainage of bile into the intestine.